Before using, we would like to familiarize you with the complete accessories of the Heine Omega 500 Indirect Binocular Ophthalmoscope. The Omega 500 is delivered completely assembled and comes with 2 diopter lenses as standard. In case you want to change, 2 0 diopter lenses are supplied. The power supply and various power plugs are also included. Select the appropriate connector for your country and slide it onto the power supply. Now you can charge the M-Pack unplugged batteries. Insert the plug on the left side of the battery. The diodes blink during charging. As soon as they stop, the battery is fully charged. Alternatively, there is a wall charging station where the Omega 500 can be stored and loaded at the same time. On the right side, connect the on-off switch with the short cable to the battery. Now, the instrument can be switched on via the brightness controller, which can be regulated steplessly. The protective cap is attached to the headband when used with the M-Pack battery. The rubber stopper is inserted on the headband directly behind the optics unit. It ensures that even if the head is held at an angle, the optics do not slip. A condensing lens with 20 diopters is also available. During examination, the silver ring faces the patient. The sclera depressor is available in 2 sizes. Other practical accessories, information about Heine, the instructions for use, and fundus charts are also part of the suitcase contents. In the next step, we will introduce you to the various possibilities of the Omega 500. There are 2 chapters: headband and optic settings. First, the protective cap is removed. There are 2 large knobs on the headband. With the rear knob, you can set the head circumference. The battery should be placed slightly downwards. With the upper knob, the height can be adjusted. The headband should sit firmly but comfortably. First, make sure that the optics carrier is in working position. Then put your left hand on the large position control on the left side of the headband. This allows you to adjust the optics up or down. The advantage of this design: you can fold the optics unit upwards into a rest position, for example for a short patient conversation. Now, loosen the adjustment knob so that the optics unit is freely adjustable. Guide the optics as close as possible to your eyes. Then, secure the adjustment knob. Next, the pupil distance is adjusted. To do this, look at your thumb in the light spot alternating with the left and right eye, and move the corresponding eyepiece so that the object appears exactly in the center of your field of view. Then use the left or right small knob to align the optical unit, so that the light spot appears centered vertically in the view. The thumb should now be focused. The stereo-optical vision of the instrument should now result in a round and synchronous overall picture. Now to the controls. The lever for adjusting the light apertures can be easily accessed on the left side of the optics. Here you can choose between a large, a medium, and a small circular aperture, as well as the diffuser. To select the aperture of your choice, the lever is adjusted by moving it out towards the patient. The diffuser is recommended if you want to examine the periphery more intensively. The filters are located on the right side. The red-free filter is switched on to clearly detect the vascular structures or retinal changes. The yellow filter is recommended for light-sensitive patients. Use the blue filter when examining the cornea with fluorescence. And here's the best part. There is still a lever underneath the optics unit. It allows you, and this is unique, to adjust convergence and parallax synchronously. You can now easily adjust the optics of the instrument to enter a smaller pupil size without sacrificing stereopsis. In addition, all settings of the illumination beam can be panned by several degrees to achieve a better illumination of the fundus periphery. Now we wish you a successful time with your Heine Omega 500 ophthalmoscope. Heine, quality made in Germany.